experts to discuss obesity from different perspectives and give more focus on obesity as a disease, the growing burden across Southeast Asia, how obesity science has evolved over the years, and the future of evidence-based patient-centered care. Before we begin, I'd like to introduce our distinguished panel. So we have with us Dr. Sanjay Kalra. So Dr. Kalra is one of Asia's leading endocrinologists based in India. He is a former president of the Endocrine Society of India and is internationally recognized for his contributions to diabetes and endocrinology, with more than 1,000 scientific publications. Dr. Kalra has played an important role in advancing metabolic health and obesity care across the region. Joining us from Australia is Dr. Mark Mella, a general practitioner and clinical leader with a special interest in obesity and metabolic health. He founded the Perth Weight Clinic and currently leads cardiometabolic services in Western Australia. He is widely recognized for his work in evidence-based obesity management and multidisciplinary care. And lastly, representing the Philippines, we have with us Dr. Marjorie Ramos, a distinguished endocrinologist and active consultant at the St. Luke's Medical Center, Quezon City, and the FEU NRMF Medical Center. She is a former president of both the Philippine College of Endocrinology, Diabetes, and Metabolism, as well as the Philippine Association for the Study on Overweight and Obesity. So, doctors, thank you so much for joining us here today. So, as you may see in our background here, we are currently holding one of the, if not the biggest, event of Novo Nordisk for Southeast Asia today. So we are very lucky to host this Novo Nordisk Southeast Asia Obesity Summit, where we have invited over 250 delegates from around the Southeast Asia to join us in a scientific session later this evening. But now we want to hear more from our speakers who will be talking about obesity later today. So first, let me start with why. Why are we talking about obesity today? Why is it different now? Because if we think about how the conversations have evolved, I think 10 years ago, we were talking about obesity in a very different way. So I'll start with Dr. Mark. That's okay. So, Dr. Mark, what has changed in our understanding of obesity in the last decade?
Well, a lot has changed, and I think probably if we think back over the last 30, 40 years, the narrative has always been that obesity is a lifestyle choice. It's an issue around willpower and motivation, and I think most of the treatment is focused on that. We know that there's been a plethora of fatty diets and lots of health approaches to try and get people to increase their motivation to undertake activity and eat less and eat more. But when you look at the evidence around what impact that actually has, yes, short term people can achieve weight loss if that's what we're thinking about in terms of weight loss. But of course, it's much more than that. It's about health of the individual. When you look at the long-term durability of those approaches, they're just not there. So there's been increasing recognition that actually those approaches to behaviour change alone perhaps don't work. And of course, at the same time, we have increasing clinical awareness of the biology of obesity and understanding that actually this isn't an individualised problem. This is a complex problem actually with many determinants that are largely beyond the choice of the individual. So we're shifting away from the erroneous narrative that obesity is an individualised problem, it's a choice issue or a motivational issue, to one of clinical understanding. And I think alongside that, we do have effective treatments, particularly in the pharmacotherapy space, which is helping us to really understand that if we do treat people, not just with pharmacotherapy, but that specifically has shown that people can lose weight, improve their health, which is the important thing here, not just the weight loss, and it's durable. And I think that's helping to unpack that obesity is not just an individual's problem. Actually, obesity is a chronic disease process, like many other chronic diseases, and it needs to be seen through the same equity lens as those diseases when it comes to access to treatment and support for these people living with obesity.
Thank you, Dr. Mark. And would you say that people are now more aware of this definition of obesity, or do you think there are still some misconceptions that is prevalent?
There's huge misconceptions, and I think much of this is born out of weight bias and stigma, which is highly prevalent in societies. Certainly, where I work in Australia and in the UK, where I'm from originally. There's bias and stigma is highly prevalent in healthcare as well, and it's prevalent in political circles. So there's inaction on policy that can really help to address the inequity issues that people living with obesity are experiencing. But certainly amongst healthcare practitioners as well, it does exist, the idea that this is an individual problem. And that's the whole point of these forums that we're holding today, to really try and raise awareness of the biology of obesity and shift the narrative away from the individual, recognise that it's actually separate from it, and it can be treated.
Thank you, Dr. Mark. So I'd like to ask a question to Dr. Marjorie. Dr. Marge, thank you. So how does, does that also reflect in your practice here in the Philippines on how patients still sort of misunderstand what obesity is about?
Well, yes, although there's been a change in the landscape on how our patient with obesity think about it. So a couple of years ago, it's not an issue. Okay? Patients don't come to the clinic complaining of the weight. Okay? They're complaining of the other diseases like diabetes, although most of us will recognize that there is weight, but it changes now. So patients go to our clinic thinking of their weight issue, but the problem is they're merely thinking about the weight. They're not looking beyond the weight, meaning what is the effect of their weight. No? So currently, some patients do look at it on the physical aspect only, not realizing that beyond the weight, we're more concerned of the complication brought about by obesity. But somehow, I think it's a first step that these patients are now coming in, and I think we just have to tell them that beyond the weight, we're looking more into what will be the benefit beyond the weight if we address the issue.
Thank you, Dr. March. Dr. Sanjay, I'd like to direct this question to you, because we did discuss how obesity carries a stigma, and I'd like to ask your opinion on how stigma still sort of influences patients when seeking help. Like, what's your take on that?
This is a major problem, and obesity is not just an individual disease, it is a disease of society, of the country, which means that if you call it a disease of the community or of the society, it means all of us have a right to treat it, to manage it. All of us have a responsibility as well to treat it and manage it. Unfortunately, we don't fulfill our responsibilities in the right way sometimes. So when it comes to communication, there are times when, whether purposely or just without meaning to, I might be rude, I might be sarcastic, I might be judgmental with my patient. And this is what we see routinely. So someone just telling me casually, you're so fat, you're obese. I don't like that. If that happens to me a couple of times, then I will not go to the doctor or the nurse. If it happens to me a couple of times, I will not want to go to the gym, even though I need it more than other people. So this is a big issue, this issue about stigma. If you allow, Madam, let me talk about the power of the press. Many times we use words in our written or in our spoken communication, whether in English or in Tagalog, and we might say an obese person or a fat person. When you write that in print, that also has an impact on the person who is reading it. And there is this concept of quinary prevention. We have different levels of prevention. Quinary prevention means that we enjoin ourselves, or we take the responsibility upon ourselves to promote the right information and fight misinformation. Misinformation will not only be scientific in terms of how to treat obesity or not, it will also be in terms of how to approach obesity. So we should have a respectful language towards everyone. This is a major issue actually, and we need to speak more and more about it so that we don't make mistakes.
Yes, definitely. I agree with you, Dr. Sanjay, and maybe that's one takeaway that we can give the press to maybe shift their mindset as well, to tell the public that we need to use patient